What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? Today, guys, we are going back to basics and we're talking simple instruments. Yes, I know some of you guys are going to drag me through the mud and tell me, no, there's no such thing as simple instruments, but I call these simple instruments because these are instruments that we often overlook because there's no moving parts. It's just a solid piece of metal shaped to its form, and we kind of ignore some of the telltale signs on these instruments. So in decontamination, let's start right there. So we have 4 different instruments here. There are so many more out there in the market, but call them what you may call them. A vein retractor, some type of nerve retractor. This is actually a specialized instrument from a specific company. It's I think it's pronounced D.W.D.Y, a D.W.D.Y elevator. It's more like a rasp to me rather than an elevator, but it's with a serrated tip on there, and I'm going to show you why this is often missed. This one's called a Middledorf retractor. I know this as a thyroid goiter retractor, but again, depending on the company. And then, plain and simple, this one can't be confused. This is a number 4 knife handle. So why do I call these simple instruments? Again, it's one solid piece. Nothing's missing. No weld points, no nothing. It's just a piece of molded stainless steel. No sharp edges for us to test or anything like that. So we often overlook this. So in decontamination, again, you should always concentrate on the working end of the instrument. So whatever that is you're gonna do, whether you're gonna brush it, use a towel of some sort or a sponge, the working end of the instruments, you wanna make sure that you got that, rinse and wipe down along the shaft of the instruments. And of course, there's going to be bloody hands, so make sure that you take care of them rings. Same thing with this retractor here, Middledorf goiter, whatever you want to call it. You want to get around there, around the working end, the shaft. Yes, there's some tape on there, which is supposedly a no-no, but if it's well maintained, sure thing. But how many places really maintain their tape? Knife handles, again, please make sure there's no blade on there. Do not ever try to take the blade off with your hand. If you do not know how to take the blade off, please seek someone who does. There are devices used to remove that you can place the knife handle in, and it'll automatically remove the blade for you. Not you have to do it manually, but be very, very careful, because those general tear resistant, cut resistant gloves, supposedly, it's not going to stop a surgical blade from slicing right through it like butter and catching you. So make sure you wipe down very well. So we're going to get to this one because this is the last one, the one that is used in arthroscopic, with an A, arthro, the joint surgery of the shoulder or knees. But this is a shoulder instrument here. It is a D.W.D.Y elevator with serration. Again, guys, this has a serrated tip on it. Be very, very careful because there can be some tissue wedged in there. And if you can see very closely, see that right there? That's a little bone cement jagged in there. So doesn't matter how good you wipe off. Now that came right off because it's been on there for a while. Doesn't matter how well you wipe off with a sponge, you're gonna actually tear the sponge up there and probably catch it in there. You can use the nylon section of this to clean off really good. But I'm gonna be honest here, this is where the metal brushes come in handy, and you need to use this at discretion. Of course, we always say follow the IFUs of the instrumentation. But if this has bone cement on there that's dried on, there's no amount of soaking and bristle brushing that's gonna get that bone cement off. You have to resort to using the metal bristle brush. Of course, hopefully your metal bristle brush looks better than the condition of this one, but you just want to brush enough on that rigid surface to remove that bone cement under the surface of the water. Not the whole length of the instrument, okay? Just that serrated area until you get rid of that bone cement, and then give it a good rinse. Resume back to your nylon brush to continue brushing off and continue on. Now we're headed, cleaned it up very well. We're heading into the prep and pack area where these instruments are usually overlooked. Lighted magnification is normally not used on solid instruments. Let's be honest, okay? A lot of us look at it with the naked eye, you know, and say, okay, that's identifying and keep it moving. But this is where I say these are the simple instruments that get overlooked, especially knife handles. Remember, knife handles are used to do initial cuts and certain dissections of certain organs, vascular organs, so forth and so forth. So it gets extremely bloody. That blood, when the blade is placed on there, there's not a seal around the blade and the actual handle. So blood is gonna seep in to the ridges right here, these grooves right there. That's the grooves where the blade gets held in and slides in. It goes all the way around the distal tip of this knife handle. This is where you want to get your lighted magnification at, and you want to really look at that groove for any bioburden, any blood that may have been left behind and ignored in decon. Because let's be honest, many people do not pull this out and give a good wipe down. They give a rinse and then that's it. And this usually sits at the bottom of your tray with instruments on top. So contact with the detergent may not be 100%, right? Or very well. It's usually laying flat like this. The actual serration, the actual groove is laying horizontal to the tray, not vertical, so that impingement of the spray arms hit up and down to really get those little nooks and crannies there. As far as our solid piece instruments, it is always recommended to use your lighted magnification to look at that distal tip. All right, it needs to be a smooth. If it's supposed to be a smooth retractor, then it needs to be a smooth edge and rounded tip. So please inspect those distal tips, that working end. Make sure that it's nice and smooth, that there's no jaggeds or burrs or cracks that may have occurred from excessive bending of the instrumentation. And don't forget the handle, right? I've seen handles crack, and I've also seen bone cement because the doctor works with the bone cement with his hand, and he may put it onto the joint with his bare hands and then grab the handle. So look real closely at that handle right there. See that little piece right there? That's a little piece of something. Either it's adhesive, bone cement, something. But that can be easily missed in the prep and pack side because it's a solid handle. We really don't pay too close attention to it. For instrumentation such as this, it's the same principle. Make sure it's nice and smooth. That the handle, if there is tape, that the tape is well maintained. If it looks like it's peeling off like that, remove it and check your policy whether you're going to replace it or you're eliminating tape altogether. For these rigid ones, these are the ones that are going to get you guys. These will creep up and sneak up on you. Check the distal tip, the proximal tip handle, because again, bone cement, grabbing the handle, this little ring here is actually used to put your finger in there to give it a good leverage. And check that serration, lighted magnification on that serration. Make sure you haven't missed any cartilage, bone, tissue, blood, bone cement, foreign matter, even leftover sponges and towels that may have got caught up in the decontamination process while cleaning. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself, and until next time, peace.